Hey, my friend, on today's very manly episode, we talk about how to boost sexual performance for men, how to reduce erectile dysfunction through a new device, as well as how to beat or reduce Peyronie's disease. Stay tuned for a very manly episode. Hey, my friend, on today's show, I speak to two gentlemen about the penix, which is an acoustic sound wave device that helps break up the plaque in your penis that may be causing erectile dysfunction. We discuss the science behind this device, and we also touch on the results that many men are having. I have tried this device by myself, and I have to say that I'm pleasantly surprised by the results. Now, the show notes for this episode can be found at antiaginghacks.net/the penix. I have two guests today, Dustin Wolff and Dr. Thompson. Dustin Wolff is the founder of the Novus Center in Studio City, California, and Dr. Thompson is a urologist and an anti-aging doctor. Both of them operate clinics where they help men look good, feel good, including with sexual issues. Dustin Wolff has worked with multiple Fortune 500 companies in the health and wellness space in various sales and marketing roles for the last 20 years. Over the last 2 decades, his diligence and dedication to the wellness of mind, body, and soul has led him down many paths. Through trial and error, always willing to test new and innovative methods of reaching higher health, he's been able to optimize not only his quality of life, but also the lives of those around him. His deep knowledge, experience, and passion to help others achieve optimal health is what led Dustin and Stephanie Wolff to open the Novus Anti-Aging Center in Studio City, California. Dr. Thompson graduated from the University of Missouri at Kansas City Medical School and completed his residency in urology in Louisville, Kentucky. And he was a urologist for 20 years. And at Southeast Missouri Hospital, he served as a chief of surgery and chief of staff. Dr. Thompson, in his 40s, developed some disturbing changes in his health and elected to go through an age management program that changed his life both physically and professionally. He completed an extensive training program and has gone on to be a leader in the anti-aging field of medicine. He's practiced in this field for the last 10 years, and in 2015, he opened the Thompson Clinic so that he can extend this unique type of medicine, guidance, and care to others nationwide. With that said, let's dive right into this exciting interview. Hello, everybody. We're on the Anti-Aging Hack Show, and today I have two very interesting guests, and we're going to talk about something that's very interesting to men. So with that said, what we're going to talk about today is erectile dysfunction. And for that, I'd like to welcome two very cool guests on the show, Dr. Thompson and Dustin Wolff.
Thanks, Faraz, for having us on. I really appreciate it.
Well, glad to be here. So what I wanted to ask you, let's start off, but first, let's figure out your backgrounds, if you will. So Dr. Thompson, tell us your background a little bit, and then Dustin, you go after.
Mm-hmm.
Well, I'm a board certified, I retired from being a board certified urologist. I have been board certified, a fellow of the American College of Surgeons, and practiced for 26 years and subsequently retired to do something that I thought was even more fun. And I wanted the ability to take care of guys and women and do something more than just hand them medication. So what I wanted to do was fix the problem, and that's where the anti-aging or the age management medicine part of my career started. It's about 15 years ago. I was the CEO, CMO for Cenegenics, Dallas-Fort Worth, and ran that for quite a few years, and then opened the Thompson Clinic. I lecture. I do a lot of TV, New York, all over, ESPN, Playboy Channel, and have now gotten involved with Launch as the chief medical officer and a partner. So it's been a wonderful life. It's been excellent. And this chapter is fantastic.
Great. Dustin?
Yeah, so, my background really is in marketing. I'll just say it up front, like I have no formal medical training, but my wife, Stephanie Wolff, is a board certified physician's assistant, and she has been for a very long time. And about 5 years ago, and she's worked in family practice, OBGYN, plastics, all that stuff throughout the years. But about 5 years ago, our kids had gotten to the point to where they didn't really need us as much anymore. They're getting in their late teens. So we decided to open up our own age management clinic. It's called Novus, the Novus Anti-Aging Center, and it's based in Studio City. And we do all kinds of cool stuff there. And we're into the, platelet-rich plasma, of course, the acoustic wave therapy. We do exosomes, hormone balancing, all the age management stuff, which has a huge impact, on the lives of our patients. So that's what, led into launch, which we'll get into in a few minutes. But it does great. And we have an amazing, base of patients, and, my staff there is incredible. The nurses and Stephanie who run the place, they get real results for people, and we see it change their lives every single day. And started that about 5 years ago, believe it or not, from our living room. And it's grown into probably one of the largest age management clinics in the U.S.
Wow, that's great. So you both have background in this space. Dustin, not medically for you, but at least managing a clinic and helping your wife provide services to clients. So how did you two meet?
We met through, I believe, it was a mutual friend of Jay Campbell, I believe. I mean, we kind of run in the same circles. So Dr. Thompson's clinic in Texas does almost, the identical, has the identical model as Novus. So we know a lot of the same people, and we know a lot of the, same doctors across the country. And we go to the, American Academy of Anti-Aging, conferences, A4M, they call it for short, all over the country, the big one in Vegas every year. So we know a ton of the same people. And we were eventually, gonna meet. Our paths were gonna cross, but we met through Jay Campbell, who's, a very well known, what you would call like biohacker, influencer in the space. He's got a pretty big following, and he's a great guy too.
Dr. Thompson, I got a quick question for you. So you're a urologist by training. For the men that are listening, what is a urologist and what do you do?
That's a really great question. And really, I'm a surgeon. Really, I'm a gentleman's surgeon. That's what we used to call it years ago. And it's a fantastic job. It's a great job. I would say the only down part is that the volume of people you have to run through your clinic to have a practice is just 40 people in a half day is ridiculous. But that's a urologist takes care of erectile dysfunction, cancers of the genitourinary system, that sort of thing, blockages, kidney stones. Kidney stones was my first introduction into what we referred to as shockwave therapy. That led on to a whole public company that I started called USMD here locally with hospitals and shockwave and cancer treatment and doctors. But that was my lead into shockwave therapy, was getting into and going through the FDA with shockwave machines for kidney stones, which we're all familiar with. Mm-hmm. It was that technology, interestingly enough, I always tell the story, and Dustin rolls his eyes like he always does when I start talking. But
no, it's not.
It's true. But so one of the guys who was with the company we're going through the FDA with left and went to Europe and started with a lower intensity acoustic wave machine. And all of a sudden he called us and he goes, "You're not going to believe this. We're healing non-healing ulcers in the extremities on all these people with diabetes." And I couldn't believe it. It sent me pictures. It was true. That's when we started to pick up on the idea of neovascularization. And that's really how this whole field that we're involved with started. Really started in Europe, doing a low intensity shockwave, even for plantar fasciitis and that sort of thing. It was never used for erectile dysfunction. It was always used for non-healing ulcers. Plantar fasciitis was another, tennis elbow, that sort of thing.
So how did it get, obviously, there's a lot of energy that you need to blast kidney stones. I assume that plantar fasciitis and some of the other things, the ulcers you're talking about, needed a little bit lesser energy. How much energy do you need for erectile dysfunction?
It's a different energy. See, that's kind of a focused energy. So what you do is you have through a parabola, you have a predetermined focus point. And that's at a certain depth. Okay. And if you can get that lined up with your stone, you can focus that energy right down on the stone. Now, what you want more than a focused energy source, you want a radial source where where it sends the energy more, I don't want to say superficial, but it is. It doesn't penetrate very deep. So you're treating more superficial things. That's why plantar fasciitis, tendonitis, cellulite, erectile dysfunction are so amenable to this treatment. Is we can get right to the what we need to treat, whether it's the corporal bodies or the tendon, whatever, because it's so superficial. So they're different. They really are different types of shockwave. Ours is not focused. The energy level is much less. It's been 15 years since I've broken a kidney stone. So even though I took 2 machines through the FDA, you'd think I'd have that imprinted in my brain, but I have to throw some stuff out because there's no more room up here, and I'm not the smartest guy in the world. So, I mean, I threw out 6th grade the other day. I threw the whole thing just out, just to make room for new stuff. But it is a different technology, and that's what we have to remember. This is not something to be afraid of. You know, with the original stone machines, we would do CAT scans after, when we were going through the FDA, and we would do CAT scans after we broke up stones in the kidney. We fractured kidneys. I'm telling you, it looked like a motor vehicle accident kidney. There would be blood all around the kidney. It got to the point where you didn't want to do a CAT. You tell people, don't do a CAT scan. Whatever you do, don't do a CAT scan, because it'll scare you. They all healed, but you realize that we were using way too much energy, and that's when we started dialing it back. And when they really dialed it back is when we came in and started to be able to use it superficially and unfocused it.
Got it. Okay, thank you. We'll come back to acoustic wave therapy for erectile dysfunction in a second, but I want to go back up and ask you, obviously there's a lot of factors that go into getting an erection for a man. There's obviously the brain, the nerves, the muscle, the endothelium, but there's also lifestyle that can have an impact on an erection. So in your opinion, Dr. Thompson, what are some of the most common factors that cause ED in men nowadays?
Well, this, I guess, is a great time for me to say this. I'm in the midst of writing a book on a vegetarian diet, which I believe is very important. Having said that, prior to the little blue pill, as a urologist, we felt 80% of erectile dysfunction was secondary to psychiatric problems, and we sent everybody for counseling. Everybody, before they get anything done, they went for counseling.
Interesting.
Then they invented this little blue pill, and it totally changed everything. All of a sudden, we totally reversed that and said 80% of it is vascular, and it's probably greater than that. And you know, then you have a certain percentage that's secondary to trauma or surgery, and then you have some psychiatric components. But it's much greater than 80% is secondary to vascular compromise. And so when we talk about cardiovascular disease in my book, which isn't not out yet, but you know, it'll hit shelves. It'll be #1 Amazon. You'll be able to find it.
Of course it will.
Of course, you may never see it. You know, it may be hidden in that behind the thing at the cash register at the supermarket. But it's vascular compromise secondary to our lifestyle, whether that's smoking, poor diet, you know, high in trans fats, sugars, simple carbohydrates, over refined grains. Those are potatoes. Those are all things that lead to damage of the endothelium. When the endothelium doesn't work, it doesn't produce nitric oxide. When the nitric oxide's not there, then you start the accumulation of what we refer to as a plaque. And the only problem I will say is when we talk about plaque and we talk about fixing things, we all in our mind think of a plaque as this hard thing on the surface of the vessel, when in reality, 80 to 90% of cardiovascular events and erectile, when I say cardiovascular, just interchange it with erectile events, is a rupture of a soft plaque, which is in the intima, in the wall of the vessel, where the LDL cholesterol, the bad cholesterol, gets in there and forms foam cells. And the damage is secondary almost always to things we're doing to our bodies through our nutrition, through not exercising, smoking, all those things contribute to it. So if we can begin to change those things, if you look at Dean Ornish in his study, this is back in the 80s, I believe, where he just changed inoperable people. So they couldn't operate on them, inoperable. There's no way they're going to have heart surgery. He took them, sequestered them, put them in a hospital, and did a vegan diet, meditation, yoga. I mean, he sequestered them. There's no way they're getting out. 3 months, all of them did better. They didn't need surgery. And 75% of those people went on to do fantastic. So if I say the problem is we never think cardiac disease, erectile dysfunction is really a systemic problem. We can help people, just like the cardiovascular surgeon can fix your heart. We can fix your wiener. And that's a medical term if you didn't know that.
It is.
But we can fix that. Isn't that a medical term? But we can fix that. But we ask you to help us and change some of those problems. So, I mean, if you look at metabolic syndrome, all those things that go along with cardiovascular, all go along with erectile dysfunction. So there is lifestyle. You know, there are some people that just have poor protoplasm, so to speak. They're just not good. But beyond that, the majority of people, it's a lifestyle thing. Obesity, poor diet, not exercising, smoking, too much alcohol, all those things that we're well aware of. And you know, another interesting fact is if you look at people who have cardiovascular bypass, those people don't live any longer. They don't live any longer. They have a higher quality of life, but their longevity is no better. It's not better because they don't change their lifestyle.
Right?
Yeah.
That's what we're trying to do. And that's why I'm writing the book to go along with the Phoenix is to say, hey, I'm not here to scare you. We're here to educate you. You know, look how good Dustin looks. I mean, he's so healthy. He's gonna have erections still. He's like 100. Plus, he's got his Phoenix with him all the time. I see this.
I take it with me on vacation.
Yeah, I mean, you know how some guys have the skull can in the back pocket. He's got
I got the Phoenix.
Print of the Phoenix. Yeah,
that's fun going through security at the airport with it.
I got stopped. You know that?
Almost every time I get stopped.
What do you carry in a little backpack?
Throw in a backpack, and it goes through, and the guy pulls it out. He's like, "What is this?" I'm like, "Do you really want me to tell you what it is?"
It's very interesting.
Put it down pretty quick when they find out what it is.
Oh, they're like, "Oh, okay, put it away."
I got you. So, Dr. Thompson, you're saying this is more of a lifestyle issue than anything else. But if men start to see signs of erectile dysfunction or ED, that means they're probably having it in their other areas in the cardiovascular system, especially around the heart as well. So this is almost a wake-up call for men that go through ED to fix their lifestyle, so to speak.
Yeah, absolutely. I remember one of the urologists, I was in a meeting and one of the urologists said, you know, you're not going to believe this, but men who have impotence have a higher risk of heart disease. And I kind of thought, no, yeah. Did you miss this? That's a systemic problem. And what we want to do is we want to be able to help you have good erections and maintain that part of your life, but also keep you from having it recurring all the time or getting worse or having heart disease.
Mm-hmm. Okay.
It's great to go out with an erection, but I'm not ready to go out.
Yeah.
If you know what I'm saying.
Yes, exactly. So I want to ask you both a question because you both run clinics and you see men on the regular. ED obviously is becoming more prevalent these days. What age ranges of men are you starting to see in your clinics? Are we talking men in their 50s or are we talking men in their 30s?
We'll have the exact same answer, Dustin. You know it.
I mean, most of our guys that come in, you know, they're 50 plus, but we get a good amount of guys that are in their 40s, even some down into their 30s, you know, that, you know, are having, you know, issues in the bedroom or starting to develop symptoms of ED. You know, not as many as guys that are 50 or 60 plus, of course, but yeah, we're seeing that, you know, we're absolutely seeing that. And, you know, we see it all day, every day. Our clinic probably does 15 to 20 shockwave sessions a day. It's LA, there's a lot of people, but still, it doesn't surprise me that these guys come in and once in a while I'll still do the consultations with these guys. But yeah, we go through the whole health checklist, just like Dr. Thompson was just saying, and we'll go through their diet, we'll go through their medications, we'll go through lifestyle, start talking to them about exercise and what they do. And, we write everything down and do a, true consultation on that. But, it doesn't surprise me that, we're seeing guys, in their 30s, come in, I'll also screen them because listen, this, the in-clinic shockwave, or acoustic wave that we do on guys, it is not cheap, and we'll get into that in a few minutes. It's expensive, it's thousands and thousands of dollars for these guys. So I want to make sure that, we kind of, weed out by process of elimination, all these other factors that can contribute to it. And one of the things that I really focus on during the consultation is their mental and emotional state, right? Because I've had a lot of guys come in, sit across from me, perfectly healthy, and they're like, I don't know what happened. 3 months ago, everything just went downhill. And I'll start digging into their life. And then I'll find out, listen, they lost their job. They're going through a divorce. There was a death in the family, depression. And when we talk about, being in the right state of mind and mentally, all these things work together when it comes to, having a healthy sex life and a good quality erection. So the guys that are really depressed, I can see it, and I ask them, and not because they can't get an erection, that there's depression because of other things happening in their life. I kindly turn them away. We refer them to a counselor, and I'm like, listen, man, I really don't want you to come in here. Like, like Dr. Thompson was just saying, I really don't want you to come in here and spend, all this money and, you don't get results because, of something else that's going on in your life that is contributing to this. So let's go get that fixed and then let's talk. So I get really suspicious when I get guys in their 20s. It does happen. It's not super often, but that's when I'll start digging into their emotional state and refer them out to, one of our partners.
Yeah, that makes a lot of sense. And I've heard from a couple of friends that, yeah, of course, they have some other stress in their life, lifestyle stress, laid off. That leads to their first incident where they can't perform when they're needed to, right? Or the second incident, and then they lose it. And then they're afraid to go in these situations.
That's big. And the term is performance anxiety. And, we deal with that a lot too. Even if a guy, can't get a healthy erection the first time, it's traumatic. And think about this. I mean, this goes back to, this hundreds of thousands of years ago. We are wired as men. It's in our DNA. It is in our DNA to procreate, period. We're born like that, right? And when we can't perform, right, it's traumatizing, right? We've all been there once or twice, and I'll tell you, it's tough to shake. I've been there myself. When something doesn't work right, whatever, you start to feel guilty. You start to feel, like you're not a man and this and that. What's wrong with me? And man, it is tough to shake. And there's all kinds of, therapies you can do for that. There's, meditation, which really helped me out. Things like that can really help. But man, with that first time it happens, it's just like, wow, what is wrong with me? And then of course your partner, internalizes it, and he or she, whatever, they start to feel unloved. You don't care about them. You're not attracted to them. You're cheating on them, or you're thinking about somebody else, or like whatever, and they internalize that, and it's tough, and you can't blame them. You really can't blame them for that. So we'll have couples come into the clinic, and I tell them, bring your wife, bring your boyfriend, whatever you're into, and I'll sit there and I'll address the partner. I'll say, look, this guy right here, trust me, he wants to perform. He wants to please you as much as he wants to please himself, right? He feels guilty that he's having a hard time right now. And if you come down on him and you make him feel bad about it, it's just making it worse. So stop. I've had to have these, like, Jesus come to the table meetings with partners before and be like, you need to be supportive, and that's going to get you to where you want to be much faster than coming down on this guy, so all these factors come into play here.
Yeah, agreed. So great answer, Dustin. What I want to do is touch on very briefly, because this could be a whole hour conversation, of the traditional methods that we've used, Dr. Thompson, you've used, Dustin, you've used in your practice, of helping men traditionally beat erectile dysfunction or manage it or help it. What are those, and what are some of the drawbacks of some of those?
Go ahead, Paul.
Well, going back a few years, when we included a surgery in that, I would say traditionally, before we had the medication, Obviously, we did nocturnal tumescence studies on each patient, sent them home with a device and had them sleep with it. It fell off. It was cumbersome. But we would try and read the thing and see if they were having erections during the night. And that helped us define what the problem, whether it was a psychosomatic problem or more of a physical problem. Prior to us having the pills we use, I never used Trimix in my practice just because my partners didn't like it. I used some prostaglandin E injections. So that's where you'd see, those are the two things that people would say, yeah, I have to inject my penis before I am sexually active. The other thing we would do probably before that was use a vacuum device, which we still use today to assist our patients. Not so much in the bedroom, but as part of their therapy. We had a few other things like that, but if they failed, and we would go right to surgery, and they would have a malleable prosthesis, one that was always erect, and you just bent it up to use it, and you bent it down when you were done. Or it was state of the art when they came up with inflatables. In the pump, and we would put a reservoir in and a pump and 2 cylinders, and you could pump it up and take it down, and it was state of the art. Patients were never happy. Their size was never quite what they remembered it being. They always claimed they were shorter. I would try and tell them that it is what it is. We can't make it larger or smaller. And so there really wasn't a tremendous amount. We started using more and more Viagra and Cialis and all these medications. And as that happened, really a lot of our workups, it was like, who cares? What are we going to do about it? If I go in and do any vascular procedures, they almost all 90% to 100% fail at 2 years. So we didn't like doing that. So we kind of quit working the guys up. And when they finally failed the medication, then they had the option to have surgery. So really, it hasn't progressed as much as you think it should have. If you look at injections, people on average use them for 2 years and then quit. They just got tired of it. The pump as a form of obtaining an erection and then putting a band around the base, most of those guys lasted about 2 years, and they got tired of it. And those are national studies. Those aren't Paul Thompson studies, although they're pretty true in my practice as well. As we moved into this, here's the first thing that we have that we can really go in and treat the patient and make them better with relatively no complications or risk. I mean, there's minimal, if any. There's more risk using a vacuum tumescence device than there is using the acoustic wave penix. I can assure you of that. There's limited risk, and it's just because you got to remember and I talk too much. So if I talk too much, tell me shut up. But it doesn't penetrate that deep. So we're treating those vessels, and by treating those vessels, we're not only causing inflammation, but we're attracting stem cells into the area. And by doing that, we're beginning to increase the blood flow, and the body really starts healing itself. Mm-hmm. So that's what we look at. And then through education and through encouragement, we take them and say, hey, we can help you. We need to work on your diet. Well, I'm not giving up meat. I eat meat. I'm a Texan. Okay, but me too. But, I've quit eating meat as of a year ago now. And I don't really miss it. I don't miss the heartburn and the diarrhea and all the other stuff and the bloating. So I feel pretty good. But I tell them, if you don't want to quit altogether, let's cut way back. Right. Every meal doesn't have to have meat in it, and you cut back your meat and you increase your vegetables and your fruits, and you'll see unbelievable changes. Mm-hmm. So that, the other things we always have to do is we have to be aware of their blood sugar and their hemoglobin A1C and monitor them for being pre-diabetic or diabetic. So hormonal, hormones become a huge part of it as well. But in the overall treatment, the difference that what we do in our clinics today, as opposed to being a specialist, is we treat the whole patient. We're treating the whole patient, and we treat them with the Penix, and we get them back on the road. But at the same time, for the cost of admission, they get advice and options to let us help them with everything else.
Mhm.
That's correct.
Yeah, I mean, you know that. I mean, Dr. Thompson, you have a long history of, on the surgery side. We don't do that at Novus, but for us, like your question was, just the traditional things like Dr. Thompson just said, the little blue pill, the vasodilators, the pumps, things like that, surgery, all those things have historically been, the go-to, first, rather than cleaning up the lifestyle and things like that. And it can be tough to change somebody. They got to want to change. Right. And then, until, acoustic wave therapy came around and started getting popular in Europe. And, a lot of people still to this day right now in the United States have never even heard of this. If I lined up 1,000 guys down the street down there and asked them if they heard of acoustic wave therapy to treat ED, they would be like, what's that? Most of them, 990 of them would say never heard of it. Right. Yeah. So it's so new still to the US. It's widely known and very, utilized in Europe. And just in the last 5 years, it's made its way over here. And Dr. Thompson does a lot of this in his clinic. We do a lot of this in our clinic, and it is extremely effective. And like he said, there are virtually no side effects. There's no downtime. Guys can have sex that night. And, it's all about education, of course, digging into their diet and lifestyle too. But this is an extremely effective method to treat guys that have erectile dysfunction, right? Now, I'm going to take that one step further, and I'll tell you, and you already know this, but I want to, let your audience know that this type of therapy isn't just for guys that have ED. We have perfectly healthy candidates come into my clinic that are in their 20s, 30s, 40s, 50s, 60s, that they're like, hey, I'm what I consider to be a 9.5. And I heard that this can make me a 10, right? And those guys respond really, really well, right? They don't have the cardio issues and diabetes and high blood pressure issues that some of these other guys do. And I'm going to tell you right now, we call them the biohackers or the optimizers, right? Your audience is, familiar with that kind of lifestyle. But, we're trying to put the message out there like, look, acoustic wave therapy and using the Penix isn't just for guys with ED. It's for every guy. So think of it as preventative maintenance, right? And my partners hate when I say this, but this is think of this as like exercising a muscle, right? It's the sound waves in a very therapeutic, low dosing way cause microtrauma, clear the plaque out of the blood vessels, increase blood flow, attract stem cells, everything that Dr. Thompson just said. Why would you not do that even if you're a perfectly healthy guy? So I get guys all the time like, oh, I don't need that thing. I'm like, just try it, right? Just try it, right? 2 weeks later, they're like, oh my God, I had no idea. Well, Dr. Thompson has a good analogy. He says, Father Time has a way of taking this dial, at the age of about 18 to 20 years old on us and slowly starts dimming the lights on us, right? You don't even realize it's happening. You turn 40 years old, you think you have pretty good sex life. Guess what? It's not like it was when you were 20 years old. I promise you, right? So that's what this type of treatment and therapy and specifically the Penix was designed to do, was to not just treat guys with ED, whether it be, moderate, mild, or severe, but also introduce this as just a men's wellness therapeutic type of treatment that they can use in the privacy of their own home and just squeeze out that 1%, right? These biohackers, they're always looking for ways to just get a little more, a little better sleep, just get a little stronger, get a little this, get a little, and that's exactly what this thing does. So, having the conversation about ED and acoustic wave therapy, yes, it works. Yes, there are dozens, if not hundreds of clinical studies that have been done over the last 20 years to back it up, show the efficacy, show that it's safe, show that, anybody can use this. It's very effective on those guys, but it's also for any guy. I'm like, if you're a guy and you're over the age of, let's say 25, 30 years old, there's no reason why you shouldn't introduce this into your, call it, weekly routine.
Dustin, thank you for explaining that. I will tell you my story in just a second of how I use the device. But just to kind of round the corner here, what this device is doing, it's using radio sound waves that go in and clear the plaque out of your penis, out of the arteries in your penis. And it also, from my understanding, creates new blood vessels. New blood vessels attract new blood flow. That blood gets trapped in the penis while you have an erection. Therefore, you have a better erection that lasts a longer time, so you can satisfy yourself or your partner, whatever your jam is. Correct?
Yep, that's correct.
No,
Okay.
there are studies, and there are a few studies, and I know, Dustin, you've seen them, where they actually did a heart. I mean, not a human heart, but they actually used it in a heart, and that was a huge vessel. And so the artery, the arteriogram was incredible pre and post treatment. So, but what we tell our patients is a lot of times for our neovascularization and our treatment, we may be treating a capillary that you can't even see. So sometimes that's hard to see, but that's what it's all based on. We need that in the wall of the vessels. That's why we can use it for, and we haven't gotten to that yet, but that's why we can use it in things like Peyronie's, is to try and create the neovascularization that's so important for these individuals and for every individual. It is like a dimmer switch, and it changes slowly, and we don't appreciate it. So it's a great opportunity for men of all ages to be able to have and do tune-ups just like you do on your car.
And over the last year, Dustin, you mentioned being a biohacker. I've gotten extremely sensitive to anything that can help me create angiogenesis in my body, which is better blood flow to your face, hair, and now the penis, because all of that matters. And better blood brings with it more oxygen, more nutrients that your skin and your body and your penis so desperately need. And in the case of the penis, it needs it for actual becoming hard. And so now let's talk about when somebody takes the device. So you've got a device, Dustin and Dr. Thompson. There's as you mentioned, these therapies are being done, have been being done in clinics for a while, administered by professionals that know what they're doing. But you've come up with the first device that men can purchase and take home and use it from the privacy of their home. Tell us why that's important.
All right. So I think it's important to take a couple of minutes to just paint the backstory as to why we actually created, invented, and patented this groundbreaking and very disruptive technology. And, I own a clinic, Dr. Paul owns a clinic, and we'll tell you firsthand, like, this is a rich guy's game. I'll tell you right now, the average guy cannot afford this. You're looking at, you come into my clinic and it's not, it's one of those things that you're looking at a series of treatments, somewhere between 6 and 12. There are standard protocols out there. We usually do 6, 10, 12. These guys are looking at $3,000 to $6,000 for a finite series of treatments. That's a lot of money. And, what I figured out was early on, about 3.5 years ago, 4 years ago, for every 100 guys that would call my clinic, as soon as I would say how much it costs, just click, you could hear the wind just come out of their sails. And they're like, oh my God, I heard about this amazing thing. My friend did it. And how much is it? And I would tell them, they'd just be like, oh, I don't have that kind of money. So it just became obvious. And I wasn't the first guy to have this idea, but I was lucky enough to come into contact and meet some very talented, very special people that helped me bring this idea to fruition and make it a real thing that is getting fantastic results. And, we're shipping thousands of these units all over the world, and we're getting incredible testimonials. But so that's how the concept of the Phoenix was born. And then I met my partner, John Hoffman, who's actually the super talented guy. He's the guy that actually invented the technology that is now patented inside of the Phoenix. So, to sum that up is that the three reasons why guys cannot or will not get treatment for something like this in a clinic are the following: the price, right? Most guys just don't have $3,000 to $6,000 laying around, right? So price. I'm like, if we can invent, the exact same technology that does the exact same thing in the privacy of someone's own home, I go, we can help millions of men all over the world, right? So price. Then there's proximity to a clinic like mine or Dr. Paul Thompson's, right? Relatively speaking, this is what people think is a new technology. There's probably less than 500 or 600 clinics in the US right now doing this, right? So that's not a real big number. There's 300 million people in the US and 150 million men. You get some guy that's in Kansas somewhere 400 miles from a clinic like mine or Dr. Paul's. Even if he has the money and he's willing to invest in his health, his sexual health, he can't afford to take time off of work and drive 400 miles, 12 times away from his family, work, job. It's just not realistic, right? That's the second reason, right? And the third reason, and equally as important as the first two, is the shame and embarrassment factor. So even in today's day and age, like we just talked about earlier, these guys, that are developing these symptoms, they feel ashamed, they're embarrassed. I see it every day. These guys walk into my clinic, we call it the Eeyore syndrome. They come in like this and, they're hanging their heads, they have no confidence. And these poor guys, the last thing in the world, trust me, they want to do is come in, sign in, at the front desk and front of some pretty girl and say, oh, I'm here for my ED treatment, and then let alone go into, a treatment room, take your pants off and have some stranger, handle your stuff. It's just a very, very uncomfortable situation, right? So those three things are really why, the Phenix is born and is such a groundbreaking, very disruptive technology. And it's changing the lives of thousands and soon to be tens of thousands and millions of guys all over the world. And I'll tell you right now, you're probably going to ask, but we went through 27 iterations, 27 prototypes over the course of 3 years to be able to mimic the identical, what we call energy signature that comes out of the Phenix that is produced in these very expensive medical grade devices coming out of Europe that are used in clinics like mine and Dr. Paul's all over the world.
Wow, that's pretty cool. How did you measure the sound waves? Was it some kind of, you weren't using penises, were you?
Yeah, no, there's a video on the website that demonstrates it. But what I'll say is we purchased a very expensive piece of equipment called a force plate. And we had to sign a bunch of waivers from this company saying that we wouldn't build bombs with it, which was wild. Wow. So we got this force plate. Yeah, trust me, I'm not into bombs. No. So we got this force plate, and what we started doing was we started by calibrating and identifying the energy signature, the sound waves that are coming out of these medical grade devices. And it looks like a scale, like you stand on a scale, but it's extremely high tech. You plug it in your computer, and then there are different, charts and graphs. But basically, when you turn it on, it looks like an EKG, like it goes like this, and you can do timed tests, right? So what we were timing was the amount of pulses, we'll call them pulses, coming out of the tip of the device every second, right? Because you can set the settings on the medical grade device, right? And usually it's somewhere between 15 to 20 pulses per second, right? It's really rapid, and it emits a nasty sound wave, and it's like, whoa, it's kind of jarring, right? So that's how we were able to calibrate and identify the energy signature that's coming out of these medical grade devices, and then tweak and change and tweak and change the technology inside of the Phenix to mimic the exact same energy signature that comes out of these medical grade devices.
Yeah, seems
There's a lot
cool.
that went into it, and it's extremely technical, and I'm not the tech guy. My partner John is, but I was the very first guy, we'll call me the guinea pig, to use every single prototype on myself before we actually tested it on patients. So there's a whole backstory to that. We could talk about that some other time.
But you're still standing, so that's good.
Things are working fine.
Things are working fine. Good. So now tell us, Dustin, Dr. Thompson, how does somebody take your device? And I can tell my story as well in a minute. But how does a man, buy the device, and what is the procedure they go through, like A to Z? Walk men through what the experience is going to be like.
Well, we have a very in-depth and detailed video that once you purchase the device, we send you to a website so you can watch the demonstration video. No, it's not on a live human being. That goes into detail on exactly how to use the device. But what's really cool and unique about this device is we tried to make it extremely simple so that any man, the average guy, could deploy it on themselves safely and effectively, right, without hurting themselves. So in the technology, you'll see if you go to the website, there are what we call these runway lights, and there's the 5 quadrants, which represent the 5 quadrants on the penis. And once you go through a series, a cycle or pulses on one side of the penis, it will shut off and it'll tell you to move to the next one, right? And the next one, and the next one, and the next one, right? And then after, this is the coolest part about it, after you're done with the treatment, which usually takes about 15 to 20 minutes, it shuts off, and we call it the lockout period, right? So the lockout period was put in there to protect you guys so that you don't over-treat. So once the device goes through one one treatment, we'll call it, takes about 20 minutes. It shuts off and will not turn back on for 36 hours. Because what do guys think? If a little is good, a lot is better. And that's not the case. And I'll go back to the gym scenario, right? No one should go into the gym and do heavy bicep curls every single day. That defeats the purpose. Your muscles won't recover, they won't grow, so this is the exact same thing, right? I call this the Phoenix. Using the Phoenix is like taking your junk to the gym, right? It needs time to recover. And you'll be surprised what happens when you take the mentality of less is more. So that lockout feature and everything I just mentioned before are all covered in the patents, but it's there for people's safety and so that they get the results that they want, need, and deserve.
Mm-hmm. Okay.
Yeah, I think what we've come up to, what we've seen is that twice a week seems to be optimal because it is just like the gym in some respects, in that we are drawing, like I said earlier, drawing stem cells in and cytokines and growth factors, and those have to work to get your results. You've now disrupted everything, caused micro trauma. Now, if we want the regeneration and growth of new blood vessels, we've got to give that time. So twice a week, which is what seems to be optimal.
Okay. And how many treatments of twice a week do you do for one session, if you will?
Everybody's a little different. We tell them 6 to 12 treatments, take a break, and then use as needed. So this is one of those types of treatments or therapies that we get some wild stories, but some of our customers are writing in and they'll use it on a Friday night if they got a hot date, coming into town or whatever. And the results, will speak for themselves, but you can go on the website and see all the testimonials, but it's as needed after that. So we'll have guys go through their first series of treatments, 6 to 12 treatments, and then they'll use it once a week afterwards, just as a therapeutic. It's just part of their Sunday routine before watching NFL football, or that's how we kind of explain it. It's as needed after that.
Got it. So 6 to 12 treatments would equal 3 to 6 weeks initially, and then do it, as you said, once a week or when a hot date's coming in town or what have you. but keep up the things, right? Keep it up.
Yeah. It's not one of those things. Yeah, it's not one of those things where you can only use it for a series of 6 to 12 treatments and then you put it away and never use it again. Yeah. No, and that's the beautiful part about this is, you walk into a clinic and spend $3,000 to $6,000 for 6 to 12 treatments. That's it. That's all you get. The Phoenix is engineered so well that we're constantly trying to upgrade them, find weak points, and break them. So our engineers in LA, they'll take new ones coming off the factory line and they'll run hundreds of treatments through it, and then they'll take it apart and they'll look for wear and they'll do this, and they're brand new. So this is one of those things where it's like you don't have to just do 12 treatments. You could do this once a week or a couple times a month for the rest of your life.
I gotcha. So it's more of a maintenance, as you said, getting the gym kind of schedule. Yeah.
Yes.
In terms of, there's also a penis pump, I believe, that's part of the treatment. So talk to the listeners about that.
Oh, you want to take that one?
You use it on everybody, don't you, Dustin?
We recommend it because the protocols and the success that we see in our clinic, the guys that follow the pumping protocol in conjunction with the acoustic wave therapy tend to get better results. So we do recommend it.
Yeah, and included with the Phoenix is a pump.
It's included with the package.
You have a pump there that you can use, and we recommend doing that. Some guys do it once or twice a day, especially during their 6 initial treatments. They'll do it every day for 10 minutes, and it seems to work extremely well as opposed to the people who don't do it. And I found it to be essential to my patients.
Yeah, he's right. We recommend it to everybody, and I tell them the same thing. The ones that come into the clinic, I'm like, you're spending a lot of money. Please listen and follow the protocol, accordingly if you want to get the best results possible. And we see a very distinct difference in the success of this type of treatment between the guys that follow the protocol with the pump versus the guys that don't. Now, that's not to say that you won't get results by just using the Phoenix or going to a clinic and getting wave treatments. You will see some benefit, but what we see is by far and away, the guys that use the pump in conjunction with wave therapy or the Phoenix get far better results.
Okay, let's talk about the results. What are you typically seeing with men that do follow the protocol as you described in, let's say, 10 to 12 treatments, and that'll be 5 weeks? What results do men report?
Our guys report, and in our clinic, we're over 82%. We're probably getting close to 85%. I think that's pretty standard. Again, you can't cherry pick these patients if you're going to come up with that kind of number. You can get a much better number if you really start cherry picking these guys and get younger guys and no problems. And that's the way all studies are done. We can get a study to say anything we want, but in all comers, I don't know if that's the way to put it, but it's probably in that it's 80+%. And then you start looking at the better we get at doing it, the better we get communicating with our patients. I think the better results, like not demanding, but encouraging them to use the pump. I think that becomes really important. So I think it's pretty general. Everybody gets 80+%. I think that's pretty standard.
Yeah, we see the same thing in our clinic. We're over 80%, 80, 85%. And that's been consistent with the penix as well. So, again, it is, especially if they're, trying to lead a healthy lifestyle, they get plenty of sleep, all these other kind of factors. But, we see a success rate of over 80%, report back that they are seeing a benefit. And a lot of times, most of the time, it's an incredible benefit. In fact, we hear I hear this hundreds of times a week, life-changing benefits.
I will just relay my personal experiences. So I started using this about 7 or 8 weeks ago, and I was talking to Austin at the time. And I'm a pretty optimized guy. I'm a biohacker. I eat well. I'm not fat, and my BMI is pretty low. I work out. But after a few treatments, man, I started seeing massive differences, and I could just feel like erections on demand. And I said, what's going on down there? Why are you excited down there? So yeah. I think just even when sleeping and you wake up in the middle of the night and you're like, I have an erection. I don't know that in the last few months, but I think that it really helps. It's this concept of breaking up the plaque and then forming new blood vessels and angiogenesis. I think what you guys have done is really, really cool. And I wish that a lot more men can take advantage of this. I think the price point is very decent, that men can actually jump in. I know a lot of men that are taking the pill, and that's what they do. They've lost the confidence, as we talked about, and now they have to resort to the pill. They can't go out on a date without having pills. So I wish they would start using some of this or this technology more, because it's really helped me, and I have nothing but good things to say about it.
That's amazing. Well, I'll tell you what, I'll throw this out there too. As we all know, the pill is just a Band-Aid. It's not addressing the root cause of the issue. And Dr. Thompson said the same thing. Eventually, guess what? It starts wearing off or not working at all.
Is that right? How long does the pill take to not work?
Everyone's different. I don't know. What do you think, Dr. Thompson?
You've got years, but the problem is, again, that's where our lives have changed. Is we're no longer just treating a problem. We're going to the root of the problem. So if we can go to the root of the problem and not just give them something that's going to get them by for a period of time, I think that all of us want long-term to be able to be active sexually, have erections, be normal men. I'm going to tell you, at 64, there's still an 18-year-old trapped in my body. So even though every morning I get up and look in the mirror and I'm like shocked at who the hell the gray-haired guy is, but in reality, I'm still 18 and I still want to perform. So I don't want to just take a pill. I want to fix the problem. So you have a period of time it's going to work, and then it stops working. And the other point of that is none of that medication is cheap, and it does have side effects. And over time, you're going to save money, you're going to save problems by using something like this.
I know, I agree. As a biohacker, this is the way to go. As we all know, regenerative technologies are changing the game. Outside of this, they're widely realized to be expensive, because when we talk about stem cell treatments or exosomes or even PRP, when you do multiple rounds, it can get expensive. And so bringing the cost down of this device, I think you're doing the community of men a huge favor. I don't love that there's companies like Hims and Get Roman that are just sending you these blue pills for how much ever dollars, but they're making it extremely convenient, which makes guys lazy. and then we start relying on that and we lose our confidence. So I think this is the way to go, where you can get your own body's ability to fight back and basically defy aging at whatever age you're at. So again, I'm a huge proponent of this.
Awesome.
So I think we're coming up on time here. One question for Dr. Thompson. Obviously, I highly recommend this device if you're going through ED or you just feel you're not as optimal as you could be. You've mentioned a few things, Dr. Thompson, about optimizing outside of devices or pills. You've said vegan diet. You've said lower your inflammation. You've said, don't eat saturated fat. You've said don't eat simple carbs. What else would you recommend for men to go alongside these treatments to have a great sex life for a long time?
Well, obviously, it's abusing anything, and we all know that to be true. Moderation is the key. Our parents taught us that, and we kind of thought, well, what the hell they're talking about? But it is the key. So we don't smoke. We don't smoke. There is no moderation allowed there. The alcohol we attempt to keep at a moderate level, and it probably less is 1 to 2 drinks for a male a day is it, and that's where you lose all the cardiovascular benefits after that. The diet becomes extremely important, and it really is important. And the way I became a vegetarian was my mentors were both vegetarians, and I was reading their book to do a podcast with them, and I thought, well, why am I not a vegetarian? These are 2 guys I listened to. So I think diet, and if you don't want to be a vegetarian, good Lord, get some fruit and vegetables in your diet and stop eating the potato chips. I mean, we're not 12 anymore. And that's a small price to pay to be able to maintain good health and not have your heart operated and your wiener operated on, or not be able to use it. Other things are exercise. Exercise is extremely important. And I don't like the people that say, well, boy, I ran 5 miles so I can eat whatever I want. And they go to McDonald's. They're set up to be dead. They're going to suffer the same thing. You can't out-exercise bad nutrition.
Nope.
So nutrition is extremely important. Exercise is one of the best things you could do for yourself besides eat right. Extremely important to cut down dementia, heart disease, erectile dysfunction. Obviously, sugar, if you have problems with your sugar, you're predisposed, and you have a high hemoglobin A1C, and you have insulin resistance. Those are things that have to be addressed. And it's really important for us as men, and I'm guilty of this. I was just in the gym before I got on this, and I was talking to my buddies, and we were all talking about colonoscopy. And I said, I got to go get a colonoscopy. We kind of stick our head in the sand. If we don't see it, we don't have to deal with it. And I think that's something we got to get over. Women are much better at getting things done than we are. One other point is, and I touched on it, and I don't mean to commandeer your podcast. I apologize for this. I want to mention Peyronie's disease because it is such a big deal. I mentioned it briefly. A lot of men, it scares, and they really won't tell. All of a sudden, they'll have a penis that goes right angle or curves up, and they'll have some discomfort with it. They'll feel a plaque on the side that it curves to, and is this cancer? 99.9% of the time, that is what we call a Peyronie's plaque. That's scar tissue in the fascia and the corporal body. And that corporal body, and one of the cool things about our treatment, I'm talking fast because I know you're up against time, but one of the cool parts about that is that corporal body has capillaries in it too. And the reason it can expand and work for our erections is because it gets good blood flow. And so we're not only treating inside the corporal bodies where you have this huge amount of vessels, we're treating in that wall as well. So that's when you realize that, you go, so I could treat the scar tissue, get stem cells in the area, and they're attracted to inflammation, and I'm going to create some inflammation. And then I get the growth factors and the cytokines, and I get all that going, and I treat it, and we have phenomenal results. Almost all those people, I either inject PRP, or in the ones that can afford it, we use exosomes. I don't use any stem cells, just because that's another hour podcast.
Yeah.
But exosomes, I believe, are fantastic, and those are they're fairly expensive, but they really, really help. and we've seen some great results. For the people that don't know what exosomes are, real quickly, they're nanoparticles, and that's messenger RNA and microRNA that go in and tell the cell how to fix itself. Mm-hmm. And so if you have scar tissue and we can get in there and they're attracted to inflammation as well, mm-hmm. we inject it right into the plaque. And Dustin, I don't know what your results are, and we've never talked about it, but we have some phenomenal results. Mm-hmm. Which, as a surgeon, I can guarantee you there's no good way to treat Peyronie's plaque. Mm-hmm. Otava, this, vitamin E, aspirin. We would come up with all kinds of crap because nothing worked. And I would mm-hmm. tell my patients, look, 30% are going to get worse, 30% are going to stay the same, and 30% are just going to get better. And what we've mm-hmm. noticed in this for the first time, surgery is horrible. It never works. Sometimes you just go in and put a penile prosthesis. No one's happy with that.
No.
And first time we have something that was one of the most exciting parts of getting involved with launch was the ability to go in and treat not only erectile dysfunction, that's really important, but Peyronie's plaque, because these guys were on their own. They had nothing.
Mm-hmm. Yep. And yeah, we have lots of guys. No, it's fine. No, we have lots of guys. We take surveys from our customers, and I see it every day. We have lots of guys that are buying the Phenix and using the Phenix to treat their Peyronies with massive success. So you can even see it on the website. It'll even say all the reviews, why'd you buy it? Peyronie's 5-star review. So, acoustic wave therapy absolutely can have an amazing effect in fixing Peyronies.
Yeah, that's a great side benefit. I didn't realize that a significant portion of men had Peyronie's, much less that the device could fix it. So great job. Dustin, awesome. We're coming up on time. So you have a website where people can go buy the Phenix. What is that link?
Yes, it's getmyphenix.com. It's very simple. So if you go to getmyphenix.com, you can go read about the technology, go look at the reviews. I mean, we have tons and tons of them. Go see them. Don't take my word for it. See what the average guys are saying about it. There's video reviews on there. There's third-party, software verified reviews. And watch the videos. I encourage you to. It'll show you how the device works. It'll show you, where it came from, why it's so important. And just like I just said, there's dozens and dozens and dozens of clinical studies that have been done by big urology groups all over the world. Don't take my word for it. Read the studies. Usually you don't got to read the whole thing. There's usually a summary paragraph right on the front page, and it'll tell you. And there's links out to these studies on PubMed.gov. Again, big urology groups all over the world have been studying this for the last 20 years or so. I just saw a link yesterday. I believe it's Virginia, a university in Virginia is actually starting to introduce this, the hospital there to their patients who are having ED wave therapy. So it's very real. It works. There's no downtime. There's no side effects. And that's where you can go get information on it. So it's getmyphenix.com.
Great. And I'll add that link to the show notes for this episode, which is going to be at antiaginghacks.net/the Phenix. And
awesome.
Dustin's been kind enough that if you use the coupon code anti-aging, you get a little bit off your device. So there's
a discount there just for being a loyal listener, for sure.
There we go. So I think that's all the questions I have for you, gentlemen. We could go on for 3 more hours.
We'll do a follow-up. We'll do a follow-up in a few months and check in on your results. And we have some very, very exciting new concepts and new technology additions to the Phenix coming out, and they're down the road, they're down the pipe, but it's going to make this incredible disruptive device even better. So make it, we're going to be able to get it out there to the masses all over the world.
Great. Sounds good. Dr. Thompson, Dustin, great to be here.
Yes, sir.
Thank you for your time today.
Thank you, Faraz. I appreciate it. Thanks for having us on.